Hi guys, my name is Amy. You are watching Health Focus in this month of December, and we are heading to the Christmas season, and I know most of us are going to indulge. Because of that, this video is created for you. You are all welcome. The topic is cancer. In the process of managing patients in healthcare, in the process of managing people in my family, everybody can tell us, or you can't avoid to know somebody who is going through cancer, who has cancer, who has passed on because of cancer. This is something that even in healthcare, it is still undergoing research. Every single thing you will hear or see being done is research that is ongoing. Nobody has an answer, but there are things that we know you can do when you have cancer. In most cases, when you get a patient who is telling you, I've been diagnosed, or my family person or my friend or something has been diagnosed with this kind of condition, you will ask, the first question, if you are in healthcare, you'll ask is, what stage is it? Let me talk about the stages of cancer. 0 stage is there is no cell of cancer in your body. Stage 1 or stage 2, it means that there is an abnormal tumor seen in your body, but it is localized. And in most cases, it's very hard for somebody to be in pain, to feel an abnormal thing in their body if the cancer cell is in stage 1 or 2. It is localized. And this stage, if it is diagnosed, you can be treated. Because it is localized, it can be treated, it can be sorted. Go talk to your physician about it. Let's come to stage 3. When you're told it is stage 3, it means it has gone to a neighboring organ. For example, if it was the stomach, it has touched the liver. If it was the lungs, it has touched the heart. That is what it means to stage 3. When it talks about stage 4, it has gone to multiple organs. So the advantage of knowing the stage of the cancer is to enable you to know the treatment journey. Various stages have various treatments. When I hear somebody is having stage 4 cancer and you're going for surgery, because if you're going to remove the liver and the cancer has gone to the brain, so get this knowledge, talk with the oncologist, get to know more information about what is my stage. I don't talk about the grading, because grading is more onto the medical field, and every medical person knows what grading is all about. But staging is information that you require the moment you are being told that you have cancer. When I get time, I'll walk you through with my closest family member who had cancer, and it was in stage 2. After touching it for biopsy, for taking of the sample to be tested, within 2 weeks, it had gone to stage 3. Cancer is as dangerous as that. The moment it is touched, the moment a surgical incision is done, it is like telling the cells, now you can move around. The best way to manage cancer is through prevention. And for you to prevent cancer, it is through some of the things we do, or some of the things we eat or take in, or some of the habits we develop. In a nutshell, let me tell you some of the things to avoid, even as you're going to the festivities and you're going to indulge in eating. There are 5 classes of foods I want you to pay attention to, and if you can try as much as possible to avoid indulging, it will be the better of your life. I don't want to say like everybody eating this food is going to get cancer, but prevention. Who said that you're not the statistics that is going to get it after indulging? Number 1, processed meat. We all know when we talk about processed meat, what this is all about. Why are we talking about processed meat? These things, they have a tendency of increasing your risk of cancer. What cancer risk do they increase in you? Colorectal, that's rectal cancer, by at least 16%. Do you want to be the statistics of 16%? I know most of us will say we are part of the statistics of 84%. But are you ready to risk it? So if you can avoid processed meat, please avoid. If you can't avoid it, just pray that you are part of the 84% that will not get that colorectal cancer. So what other thing are you going to take with care? Alcohol. We said alcohol. What does alcohol do? It produces a chemical into your bloodstream. This chemical damages your DNA. And when it damages your DNA, it tends to degenerate or generate a different thing, a different tumor. So when the different gene is generated, these things might end up to be a cancerous or benign. You never know the statistics. So alcohol is linked to esophageal tumor, that's tumor of the esophagus, liver tumor, we all know about liver cirrhosis. This has been there from the time immemorial. Breast cancer and colorectal cancer. So if you can avoid alcohol, it is for your better. If you can't avoid, just pray that you're not in the statistics. But again, we say prevention is better than cure. There is no patient in oncology departments that takes alcohol. Go do your research. All the patients, the oncology, now cease to take alcohol. Why can't you cease to take it when you're healthy, instead of going to cease it in your deathbed? The next category will ikmeni nyama choma. Charred meat, it makes the meat to produce a byproduct which are carcinogens in nature. This is research that has been done before. So these things, when you take them in the body, they distort again your cells. And it makes you develop or make the cells develop cancer. So if you can avoid nyama choma, which I know Kenyans, that is our delicacy, and we are going to Christmas, that is what we will take breakfast, lunch, and supper. If you can, let's say now reduce, but just for information, it does cause the carcinogens that develop into cancer. Have I talked about sweet beverages? That is the next category of foods. Sweetened beverages. We have them all over. What does it do? It makes you take a lot of calories into the body, more than you can bring out. So when you have more fat, more cells than you need in the body, they just start doing whatever they feel like. And most of the things that they feel like doing is just getting tumors. Like just a tumor is just a growth. And most of the tumors progress to be cancerous. So if you can avoid sweetened beverages, the better. So if you can avoid taking the sweetened drinks, please do. It's for your better. And finally, we have processed foods. Processed foods are again, they enable you to develop an unhealthy lifestyle, which eventually makes you to get in more calories than you need. Just the same case as sweetened beverages. So I was talking about cancer. When you've been told the best thing to do is prevention, develop a habit of checkup. My great condolences to people who've lost their loved one because of cancer. My great sympathy and prayers for people who are going through this journey of cancer, and for everybody who is a caregiver to our cancer patient. I know it can be draining. to everybody in our population who can prevent this cancer from coming to you as a person. Develop good eating habits. Develop an habit of exercising. Develop an habit of getting checkup annually so that you are able to diagnose early or prevent or treat early before it comes. As you go forth to indulge in this Christmas season, enjoy your festivities. But remember, your health is your responsibility. Goodbye and have a blessed week ahead.